Hello again, everyone. I'm Mark Mazzaferro, Communications and Media Officer for the City of Vacaville, and it's time for our daily COVID-19 update from the City of Vacaville. And with us, as always, on our updates is Fire Chief Chris Concepcion. Chris, how are you today?
Good. How about you doing?
Doing well. I'm happy to see that we have lots of people either watching us live or after we broadcast this, which is important. We need to get this information out to our residents.
Absolutely. So as long as they're watching and they want the information, we'll keep doing it.
Yes, thank you very much. We appreciate it. All right, so let's dive in. Let's start talking about the numbers as they stand as of yesterday at 4:30 p.m.
So yesterday at 4:30 p.m., Solano County reported 140 cases in the county. They say that there are actually 14 patients that are currently hospitalized. That's down 2 from the day before, so that's good news. The active cases did go up, but probably minor cases. And in Vacaville, it remains at 24 cases, so there was no change from Tuesday or Monday to Tuesday as far as Vacaville is concerned. So those are the current numbers right now.
Yeah, and that's good. And these numbers and what's going on in terms of the county in general is going to lead to provide answers to some of these questions that we've been getting from residents.
Yes.
And they're fair questions. You know, my dad used to say the only dumb question, you know, the rest is the one you don't ask.
Exactly.
Well, at first blush, sometimes, I will see these questions and I'm thinking, there's no answer to that question, but there is. There's always an answer. So let's dive in and get started.
Sure.
You mentioned yesterday about antibody testing, and I can't remember if you gave any kind of time frame, but someone asked, when will antibody testing be available?
So there is no specific date, but what we do know is that the FDA gave sometime last week or the week before that, I think it was called an emergency use authorization to several different companies to start producing the antibody testing. In our conversation with the public health officer and a couple of other doctors, they said it's about a month out. They didn't give us a specific date, and that's not to say that a month out doesn't mean that automatically we're going to be able to flip the switch and start testing everybody. I imagine they're saying that it's about a month out before they can start producing it and start distributing these tests to the places where they need them.
So it'll be a while.
It will be a bit before that. Yeah.
And the goal of antibody testing is what again?
It's to see if people have, it allows people to see if they have the antibody for COVID-19. And so it shows that they have an immunity to COVID-19.
I saw an article about a police officer, not one of our guys, thank goodness, but who, an agency in the Bay Area who did have COVID-19 and was tested and is being tested to see if now he has the antibody.
Right.
So once they decide whether he does or doesn't, then they'll be able to produce a vaccine. Or I mean, maybe you're not the guy to ask. You're not a doctor.
Well, I'm not the doctor.
At 1 o'clock in the
afternoon. I played
afternoon.
at a Holiday Inn Express one time. But,
exactly.
So no, I am not the right person to answer that question. There is a lot of information out there, and I would suggest to our viewers that they seek out that. The CDC has some, but if you go on the internet and Google, antibody testing for COVID-19. There's a lot of information out there and a lot of good articles as far as, exactly what it is and what its purpose is. It actually gives some timelines out there and stuff like that.
Sure. So. I was looking at the state website today, and they have they've really ramped up the information they have available there too. So that's becoming a very good source, at least for me personally.
Yeah, and one of the things, if people have watched Governor Newsom's 6-point or 6-step as far as getting the state reopened again. And one of the things that I think one of the first bullets that he was talking about is the availability of tests. So that is an important thing. So more and more information is coming out as far as the testing is concerned. But no, I'm a fire chief, not firefighter, not a doctor.
not a physician.
Yeah.
All right. Now, we talk about the numbers every day, and because our numbers are, thank goodness, low,
Yes.
certainly in relation to other communities, other states, even other countries, some people are wondering why everything is shut down. There's no pandemic in Solano County, and there's certainly not one in Vacaville. Why are we keeping restaurants and stores, et cetera, closed?
And that's a tough question, you know, because we would all like to just go back to normal and things being normal, but we can't. You know, it seems like, at least what it's showing is, if you look at California as opposed to other places like New York, for example, where, you know, we've got a lot of people in this state, yet our numbers are relatively low per capita. And a lot of people think that the reason that numbers in California are relatively low is because of the fact that the stay-at-home order happened early on in California before there was that peak or that surge. So it shows that the stay-at-home orders are actually working to keep or flatten that curve as we were trying to do. So as we mentioned yesterday, we rely on information first from the CDC, then down to the California Department of Public Health, and then Solano County Public Health. So we use that information to make decisions here in the city. We can't very well, just because there's, you know, only 24 cases in the city of Vacaville, we're saying, well, you know what, nothing's happening in our city, let's open everything up. We can't go against what those higher authorities are saying, because then we become a hot spot, right? Potentially we could become a hot spot, and we don't want to do that.
Yeah, and imagine if we decided to allow all businesses to operate as normal. There's this thing that goes right through our community called Highway 80.
Right, exactly.
I would imagine we'd be swamped with folks.
We would, and yeah, and again, like you said, I said, I think, you know, we all of a sudden, I think we'd be a hot spot.
Yeah. We would, and that's my point is, that's not a good thing.
No, I mean hotspot as in hotspot for COVID-19, not hotspot for people wanting to come here. Yeah.
Now this is one that people are talking about, and it's about the schools and why schools were closed and why that's necessary.
Again, that's a question that has an answer to it, but I'm the wrong person to answer that question. And what a lot of people don't know is that the school district is separate from city government. So we interact with them quite a bit. We talk with them and we collaborate with them quite a bit, but they make decisions on whether to close the schools or not. We don't make that decision for them. That decision is made by the superintendent as well as their board.
Right.
So we don't have that. So again, I'm the wrong person to answer that question. I would imagine that they're doing the same thing that we do, and that is relying on a lot of good information that's being vetted, and I would imagine that they're making decisions based on that information that they're receiving.
Yeah, and I mean, it comes from the county Office of Education, which gets its info from the state, the state Office of Education.
Same exact thing that we're doing. Just
climb the
move on up.
ladder, right. I will say this, I have 2 grandchildren, both involved in public schools, and the word is, when school's in session, they seem to always have a runny nose, right?
Yeah.
They have a cold, they have a this, they have a that. Not right now. I mean, if there's not a better example of how social distancing will keep you healthy, maybe that's it.
Yeah, I mean, you know, preschools and schools, I mean, it seems like if there's something if there's a flu going on or a cold going on in the school, you can bet, I've got all four of my daughters are products of public education, and and we knew when it went through where there was a flu season or a cold season, they were going to get it.
Right.
And so, I mean, it's just that,
And similarly, it's not just about the kids. How about faculty and staff? And I mean, there's a lot of folks involved in every school, a lot of close contact.
Absolutely.
Just lining up at recess.
Right.
So yeah, I mean, you're right, we don't run the schools.
right, we don't run the schools, but I would imagine they did not make, like we do not make decisions arbitrarily.
No.
I don't imagine they do either.
All right, now this is a question that was posed that at first I thought, how do we know that? How could we even answer that? But then the more I thought about it, it was like, well, sure, I've seen people try to answer this question, and that was, how many cases of COVID-19 are they in our community that we don't know about, or that people haven't been tested?
There's really no way to know.
Right.
There really is no way to know. I mean, there's unless with the current testing, the RNA testing, we don't know. However, with the serologic testing or the antibody testing, we might get a better idea when that time comes that those tests are more readily available. But until then, we just don't know.
I've read articles, people, experts, doctors, guessing. And that's kind of dangerous in this situation.
And that's all that is a guess.
It's a guess.
Yes, it is absolutely a guess. And and what we've been taught is we never speculate, right?
Right.
And that would be a dangerous speculation to do.
Now, this is one that I think we can talk about and maybe even do something about post-coronavirus pandemic. And that question was, are we making any plans? And well, I mean, we're always planning, but are we making any plans post-pandemic to offer classes or training for folks to, kind of avoid this situation arising again, whether that's, home sanitation, personal hygiene, whatever it might be?
Yeah, we don't want to have to go through a situation like this, but like with any kind of disaster or any kind of thing, we in the fire department or as city are responsible for emergency management, right? And so what we do is we take the emergency, first we mitigate it, and then we recover from it. But from that, then we go into the lessons learned, right? The after action on that. And we're going to do the same thing with this. And whatever we think we need to do in order to make things go better the next time, or in order to prevent something like this from happening, we'll definitely take a look at that. And I would imagine, we don't know what that program looks like yet,
Right.
But I would imagine that there's going to be education, there's going to be more planning, there's going to be all kinds of different things that'll help us, number one, to prevent something like this happening, or if it does happen again, how do we get through it better than we did this time around?
Right. Both of our public safety agencies, police and fire, have a crime prevention and a fire prevention division. So
Yes.
that's just part of the mindset of what you folks do.
That is absolutely our top priority. Most people don't know. I mean, that prevention is our top priority as far as the fire department is
Right.
concerned. And
So-
I would imagine my counterparts on the police department feel the same way about crime prevention.
So prevention is a big part of what we do around here all day, every day.
Yes, it is. Yeah.
And certainly moving forward when this is over, I can almost guarantee that there'll be some sort of
Yes, there will
effort
be. Yeah.
moving forward. All right, anything else you want to add today, Chief?
No, I just want to thank everybody for hanging in there. And, things are, we can kind of see throughout the country, it seems like the increase in the number of cases has lessened, if that makes sense. So, but we're definitely not out of the woods yet. We've got to continue. Now we're we're hopefully soon we'll be able to transition from the mitigation standpoint. I mean, is kind of trying to, from the point where we're trying to slow the number of cases down to the point where now we can get into what we call the recovery phase and opening up, the country to normal business. So what that looks like, we don't know yet, but we do know that the president has named a task force that he's working on at the national level. We know that Governor Newsom has had a pact, entered into a pact with Washington and Oregon. He laid out his 6-point plan yesterday. We don't have any details of that plan yet, but as soon as we learn what those are, we'll get those implemented as quickly as we can, and hopefully move on to recovery.
Excellent. And remember, we have a section of our website is dedicated to the COVID-19 issues, cityofvacaville.com/COVID-19. If you have any questions or comments, send us an email, cinfo@cityofvacaville.com, and we will see you all tomorrow. Thanks for watching.